President Moon Jae-in visited one of the capital's biggest general hospitals to explain his healthcare system reform plans. Some of the changes include a longer list of treatments covered by the state and, of course, revised co-pays, especially catering for lower-income earners. Hwang Hojun fills us in.
On a visit to Seoul St. Mary's Hospital Wednesday afternoon, President Moon met with patients there and gave a speech on his plans to reform the nation's healthcare system.
국민의 건강과 생명을 지키는 것은 국가의 가장 기본적인 책무입니다. 새 정부는 건강보험 하나로 큰 걱정 없이 치료받고 건강을 되찾을 수 있도록 건강보험의 보장성을 획기적으로 높이겠습니다.
President Moon pointed to four major things he wants to accomplish. First and foremost, to expand the range of treatments covered by state-run insurance. As of now, if a procedure is not on the government's list, the cost falls flat on the patient. But the president says under his government's plan, unless a treatment is clearly unrelated to a person's health, like cosmetic surgery, they will all be covered. The government will also bring down the upper limit on an individual's copay, especially for those in the lower 30% income bracket, down to about $900 a year. Plus, the president said, emergency financial support worth up to 20 million won, or about $18,000, will be available to those in the bottom half of income groups who contract a severe illness. The reform is expected to lower the medical expenses of an average person by 18% and by nearly 50% for those in the lower income brackets. As for the cost, the president said the new benefits will require more than $27 billion over the next 5 years. According to the Blue House, about $9 billion will come from profits accumulated up till now from the operation of the healthcare fund, and the government will shoulder the rest. As for concerns that insurance premium will rise under the president's plan, he vowed to keep them at a minimum, saying he'll ensure they rise no faster than the average rate over the past 10 years. Hwang Hojun, Arirang News.